Ladies and gentlemen, thank you for joining Health Concerns of a Stroke Survivor. Your host for today is Tickery King. Ms. King, you may begin.
Thank you very much. I'd like to welcome everyone to today's webinar. This webinar is for the DASH program and Cardiac LAN combined. It's entitled Health Concerns of a Stroke Survivor. So thank you for attending. I want to go ahead and cover some of our program announcements. Impro has gone social. We are now on Twitter, Facebook, YouTube, and LinkedIn. You can follow us at ImproCares, like Impro on Facebook, and connect with Impro on LinkedIn. For more information and links, visit www.impro.org. The next newsletter comes out in April and will focus on minorities and cardiovascular disease in recognition of Minority Health Month. Quarter 4 data was due January 15th. Please submit it as soon as possible. To request assistance in pulling data, please email us at dash@impro.org. Cardiac LAN announcements. 2014 Cardiac LAN reporting. If you have not submitted data for any quarter in 2013, now is the time to do so. New for 2014, Cardiac LAN reporting forms will be emailed to your practice later this month. Reports for baseline 2014 and quarter 9 are due by April 1st, 2014. The Governor's Award of Excellence. The GAE will be awarded on May 9th, 2014. Recipients will be announced in March. Practices are required to submit a one-page narrative summary about the steps undertaken to complete your chosen strategies and/or interventions. Indicate lessons learned, successes, barriers, steps taken, or strategies used to decrease disparities and barriers. Forms will be sent out this week. Today's presenter is LaTina Denson, PhD, AICP. I am very honored to introduce such a remarkable woman who will be sharing her personal testimony on life before and after a stroke. LaTina is a beautiful person both inside and out. She's courageous, she's strong, and she's a fighter. Her personal testimony speaks volumes to how important it is for patients to take charge and navigate their pathway to health equity. I'd like to introduce my friend, LaTina Denson.
Well, thank you. Thank you again. Before we get started, I just want to tell you that I have a speech impairment. So I have aphasia and apraxia. So, and I will discuss it later on in the presentation. However, when I speak, just be patient with me. and sometimes I cannot think of the words, but it's like a game of charades. No, not this or that, so. But anyway, and I will discuss my personal background, my health history, my primary care doctor, the stroke and stroke surgery, rehabilitation, and the relationship with my primary doctor and my special doctors, my specialty doctors. And some personal messages that I want to talk about. I am a native of Michigan. I also work and live in North Carolina and Delaware. I am a Spartan, yay, and I am also blue hen. Yeah. My profession is a urban planner and urban affairs. So, and basically what it is development, you know. My health history, you know, I did not think that I was sick or anything like that, you know. I had anemia and also fibroid. But in terms of my blood pressure and my cholesterol or anything like that, I was fine. So I didn't think anything was wrong. However, my mother's side of the family, they have diabetes, congestive heart failure, and high blood pressure. My father's side is heart disease, stroke, and thyroid. Now, when I was thinking about it, I'm like, wow, it's like, even though I knew that both sides of my family had signs and symptoms and actually have the condition, I didn't put two and two together, like, you know, so I'm thinking, I'm fine, you know. So I did not have a primary doctor. I only had my gynecologist. You know, I can do my pap smears and my and everything like that. So I'm like, I'm fine, you know, I'm fine. However, then I'll discuss my stroke. But now I have my doctor, my primary doctor, and several specialty doctors, such as I call him my rehab doctor, but it's a name. It's called something. And also my neurologist. I will talk about how the stroke unraveled. It was a Monday, and my friend and I went to Chili's right there. And everything was fine. I came home. We watched a movie. Everything was fine. And I was about to let him go, but I was feeling nauseated. And then I did vomit. But it's not me. So I'm like, ooh, but it kept going. And I tried to, do the home remedies, crackers, salt, Pepto Bismol, nothing. I just kept on doing it. I'm like, oh my God. And so what I do, I call my mama. And so she was like, okay, so she came over. And finally my stomach settled down. It's like, okay. So I said, well, maybe it was food poisoning, so I threw all of the leftovers away and everything. So on Tuesday through Thursday, I was fine. Friday, I woke up and I was fine, showered and everything. I had a funeral to attend. So I said, and my garbage can, I had to carry it back. So when I'm doing it, my walk was slow. I'm like, strange. But then I was out of breath. I'm like, wow, that's very strange. So I called, and so my grandmother called me. And I said, Ma, something's not right. I don't know what, but something's not right. So after the funeral, I will ask my aunt to take me to the hospital because something's not right. So she said, okay. Well, we went to the hospital, and I told the doctors and stuff. I said, I don't know what, but something's wrong. So they got my vitals and everything. Everything was fine, And so they said, well, we'll just see what the blood work comes in. I said, okay. We talking and everything, And 2 doctors came. She was like, you have to be admitted immediately. I'm like, why? Well, my hemoglobin was 2.6. Yeah. And so I'm like, okay, what does that mean? Because, what does that mean? And they were like, you have to have a blood, transfusion right away. I'm like, okay. And I was not even thinking about, I'm thinking, okay, well, do it. And, that's fine. So we did, and Friday, Saturday, Sunday, they put me, they kept putting blood in me. I'm like, fine. So I was released. Monday was my birthday. Hey. And Tuesday was fine. Wednesday, it was the third sign that something's not right. I had a headache. And it was not a regular headache, but I was not in pain, but it was a different headache. So I was like, well, maybe it was the weekend and stuff like that, you know. So I kept on doing what I do, you know. And my friend came and we went to the park and went to get a milkshake, and he grilled and everything, you know. And it was a firework later. I said, okay. But then as the night went on, I still had a headache, you know. And so I asked him to go home. He was like, no. I said, well, I'm about to go to sleep, you know. And said, okay, well, I'll be waiting. That's okay. So all of a sudden he said, because I don't remember, he said, as I stood up, and I said, what is that noise? And he said, what noise? I said, you don't hear that noise? And he was like, no. I said, okay. So I went back to sleep because I love sleep. And so, but I woke up vomiting again. And so something's not right, you know, but I don't know what. So he called my mother and she said, okay, let's go back to the hospital. And I remember walking to the car, and I remember when we got to the hospital, and I remember telling them I just left there. After that, I don't know anything until, 5 days after the coma. Apparently, I had a subarachnoid hemorrhage, and that the stroke is when the blood spills around the the brain, and sometimes the brain is formed like that. And my doctor said that people have that and they don't know until something happens, you know, so. So the aftermath was the right side, I was paralyzed, semi-paralyzed on the right side. And I have aphasia and apraxia. And when I first had the stroke and I was conscious, I could not talk. I could not walk. And I was somewhat confused. Like, okay, where am I? And, you know, like, I want to talk, but I can't, you know. And so I was just thinking, well, somebody will tell me something, you know. And my mom and my friend said, well, you had a stroke. But again, I don't know what you're talking about. You know, a stroke. Strokes are for older people, you know. So what is that? But I could not talk, so I, you know, and I could not write anything at that time. So I was just like, you know, whew, but thank God, thank God. The aftermath in terms of rehab, when I was still in the hospital, it was like 3 weeks before they released me. And basically, I was resting and unaware of anything. And actually, everybody was visiting me, but I didn't know what it was, so I thought it was a dream. It was a dream, and sometimes people were reading to me, or, you know, or exercising my limbs and stuff. And I'm like, is it a dream, or, you know, or what? But, and one day I thought I was on a yacht, because I'm like, everybody is coming for me, and it must be a yacht. You know, it was just, I guess it was the drugs, apparently. But then I was released into a rehab center the first time, and it was horrible, and I'll talk about it more. And then I was released to another facility, and then now I am home, and I just started rehab again, and so we'll see. The messages that I want to convey, the first one is my family did not have no information, but information. My mother said, well, she thought that I would have been in the hospital until I get well, you know, and so the hospital was wonderful, according to my mother and friends. And so she was comfortable with me being there. And, you know, whenever they release me, it will be fine. However, 2 or 3 weeks, then they were like, okay, she has to go. You know, and she was like, well, go where? So they had a list of places, but that's it, you know. And so my mom and my sisters and my friends and stuff visited the facilities, and according to her, they were not good. And so, but maybe it's because she wants the best of stuff for me. So anyway, so one like she said, one time they visited a facility and it was unkept, you know. And so the lady said, well, I know that it's not, I mean, it appears to be dirty, but trust me. No. Another, I guess she liked the facility. However, they had prisoners on the front of the wing or something, and she was like, no, you know, because my daughter cannot talk and she cannot walk, you know, so no. And so finally she picked a facility. Whew, terrible. They were unprofessional. When my family or friends were there, oh, they were fine. But after, they were talking about their boyfriends or girlfriends, and you know, and I'm like, and I'm thinking, shut up, but you know, but they were talking to each other, you know, whatever. And I'm thinking, how can I leave? You know, how can I leave? And they did not secure the bed, so I fell twice. Now, the first time, they just picked me up and, you know, but the second time, because it left a scar, then they were like, okay, we have to call the mom, you know. So things like that, I'm like, no. Oh, yeah, that's the thing. Again, they were unprofessional. And so finally, my mother tried to send me to another facility, and insurance denied it. And so but the doctor said, don't worry, we'll handle it. We will handle it. And so they did. They did, and finally the insurance said okay. And so, but it was like 2 or 3 weeks of pure hell at the first facility, and the time is ticking, you know, like, okay, you know. But finally, the second facility was wonderful, just wonderful. They had a exercise program out of the, oh God, I'm like, I'm tired, please, you know, but I appreciate it now. Yeah, I appreciate it now. But at the time, I was not a happy person. And I was not happy because it was like, what, I am tired and I have to go to work, I'm like, what about my house? What about my bills and everything? And people were like, no, just don't worry about that. But I cannot think about it. I cannot stop thinking about it, And so I was, every week, I'm like, can I go home? Can I go home? And no, And my occupational therapist said, please, just stay. I'm like, no. Well, I said, well, can I just visit my house? Because it was just like, so it was it was all of a sudden, the last time that I thought, like I went to the doctor and that's it. Now if I am sick and I have to work and stuff like that. So it really worked. It really took a toll on me. And even though the rehab facility was perfect. They were perfect, out inpatient, perfect. But I was just concerned about stuff that I shouldn't have not thought about. And that's life. So finally they said, okay, because I'm like, okay, I want to go home. And so it's okay, but understand, it's a different world when you go home. I'm like, I don't care, and I wish that I had stayed. I really do. Because now that I'm home, okay, I still have to do my rehab. However, my mortgage company calling, my bills are calling, everything. I'm like, oh man, it's just like, all right, well, okay. So, my house was eventually foreclosed and everything. So, but that's okay because I'm alive. So, in terms of the rehab, it's an ongoing thing and always changing, especially with, I have tone problems. And so sometimes my tone is fine. Sometimes it's not so fine, and it depends on the week, the day, the hour, But also, I could not have rehab unless it's a change in treatment. And so I'm like, okay, what does that mean? Well, And my doctor, he didn't know, or I don't know what he knows and didn't know. But every time I went to the doctor, he was like, "Are you in rehab?" Well, no, because it's no change in the treatment. So they will not approve it. And actually, I had a private insurance. However, I could not pay for it, and so I have Medicare and Medicaid, and so that's the life. And also pay attention to your medication. My muscle relaxer, if it's too low, it did not help. If it's too high, it stiffened me. So, and one time, I was fine. I thought it was perfect, the doses, and everything like that, fine, until my foot was swollen. I'm like, oh no, that's not it. That's not it. So, and also I want to ask the doctors, and I know that they are busy and they have a large caseload. However, sometimes it's just come in and go out, and not listening to the patient, And so, like, one time I went to the doctor and everything was fine. But then he left. He was like, okay, I'll see you in 3 months, So then I'm like, oh man, I forgot to tell him, da-da-da. So I said, hey, come here real quick. Well, no, I have another patient. I'm like, but, we will talk about it the next time. Well, the next time is 2 or 3 months, so it's like you cannot, it's just, aggravating to know that, okay, it's my life, and can you at least listen to me and not thinking about anything else but me right now, and the relationship with doctors and the nurses, and the staff. Like, sometimes the doctor will ask me something. I'm like, well, you should know because da-da-da-da, or, well, no, remember, we tried that, and it didn't work, stuff like that, or the records keeping. My primary doctor had to ask the rehab center like 2 or 3 times to send him the papers, the notes and stuff, so that he can be abreast, you know. So it's just a difficult time. I think that people need to have an independent advocate, because sometimes the staff don't want to step on the doctor's toes. And then sometimes I really don't know, or I don't know, or I'm not understanding what he's talking about. And so, and when I tell them, you know, well, I don't understand, then they get frustrated because they have to have another patient, you know, or something like that. So it's just, I think the patient advocate is key. Be aware of the policies affecting patients. In terms of my therapy, I can have physical therapy, but only if it's a change of treatment. And then the occupational and the speech, I have to but if I do both, then it will decrease my visits. So I have to, you know, like choose really, and I understand, and I'm glad that I have insurance, you know, because some people don't. So I'm grateful for that. However, just be conscious of the policies that dictate your life. And recovery is not recovery is not the same as for everybody. Initially, I was doing fine, you know, but then it was still like that. Now, since I don't have the insurance, well, now I have occupational therapy. So, however, I had to have different things to do, to be more active, you know. So I had a personal trainer. I do massages, I do yoga, water aerobics, and, the chiropractor. However, I'm not rich. And it's expensive, so sometimes people people sponsor me, so thank you. Thank you. What's next? Well, I'm still continuing therapy and exercising. I am trying to be more involved and engaged, volunteering and stuff like that. Still working on the employment. Also, I think in terms of young stroke survivors, I don't think people think that stroke, like, people always telling me, oh, you are too young for a stroke. Well, yeah, I had it, but I'm still alive, and I still want to contribute to the society. So, what now? And the last is I want to create a forum to educate people about stroke and also be an advocate to stroke survivors. And that's it. So thank you. It's just one day at a time, and I'm just thankful that I'm alive. So thank you.
We want to thank LaTina for her very moving testimony and sharing her story with all of us. As you know, we do try to give time for questions if there are any. We have a few minutes left, so if there's anyone on the line that has questions, Matthew will instruct you on how to unmute your line. Thank you, Matthew.
Ladies and gentlemen, if you'd like to ask a question, please press the number 1 key on your phone now. Again, if you'd like to ask a question, please press the number 1 key now.
I'm not exactly sure if you know exactly the time limit.
We have no questions at queue in this moment.
Okay, thank you, Matthew. This recording will be available online, and we will also send out the link to the recording to all of our physicians and practices that are represented here, as well as our community partners. There is a survey, polling questions that should pop up before you are able to exit WebEx, so we do appreciate you responding to those survey questions. And we thank LaTina again for providing us with her story, being so gracious to share her time with us. And we look forward to more webinars for our DASH program as well as our Cardiac Land program. Thank you, everyone, and have a good day.